Good evening, students and parents across Missouri. My name is Michelle Arashi, and I'm this evening's facilitator for the health professions session. And joining me, we have three wonderful ladies that will be sharing more about health profession careers and their institutions in just a moment. So it's my pleasure again to be the facilitator, just kind of running things behind the scenes. I am a school counselor here in St. Louis. So students and parents, if you would like to ask a question, you will use your Q&A box for that. I'm sorry, not the chat box, but the Q&A box. The presenters will not be able to see or hear you, so you will need to type your questions into the Q&A. They will get to as many questions as they can. If they are unable to get to your question, they will be receiving your contact information and the questions after the session, and I'm sure they will follow up with you individually in the coming weeks. Again, students, remember your camera and microphone are off, so you are watching this. We would also love for you to sign up for more sessions through our website, which is www.moacac.org. We have 3 more weeks of fabulous sessions, and again, I think all 3 of these institutions are presenting more sessions coming up. And lastly, there is a recording that will be available in the next few days on our website. And you can come back to that recording if you'd like to watch it again, or if you happen to miss something, you can come back and check out that recording. So without further ado, I am going to turn myself off and let our presenters take it away. Thank you.
Thank you. Good evening, everyone. I am so happy that you're able to join us this evening. Myself and my colleagues are going to introduce ourselves, and then we're going to jump right into our presentation. My name is Shawnee Lenore Jenkins, and I have the pleasure of serving as the Vice President of Enrollment at Maryville University in St. Louis.
Hi, everyone. My name is Susan Lutz. I'm our Assistant Director of Local Recruitment for St. Louis University.
Hi, everyone. I am Jill Gepke, Director of Admissions at University of Health Sciences and Pharmacy in St. Louis. And that's right, you heard me correctly. University of Health Sciences and Pharmacy in St. Louis. That is a new name for the St. Louis College of Pharmacy. We have expanded into the university umbrella, but rest assured St. Louis College of Pharmacy is the college underneath the university umbrella. We are just moving forward with the university to expand our offerings in health sciences and for our students and offer more opportunities for them. So we are very excited for that. We are a week into it, so please forgive me if I slip up and still reference the college at that aspect as well too. So anyway, with that being said, I am happy to talk about our Hallmark program, our pharmacy program that we have here at St. Louis College of Pharmacy under the University of Health Sciences and Pharmacy umbrella. All right, so let's see. Susan, we have the PowerPoint there. Thank you. All right, so
sharing, Jill, you're ready.
Perfect, thank you. I would like everybody who's listening along to think about what a pharmacist is and what a pharmacist does. I'm gonna try and be a psychic mind reader here for just a second. All right, so you got that picture in your head? I will bet that you probably are thinking about a person in a white coat behind a counter filling a prescription, probably for you or somebody in your family. Usually that is what people think of 99% of the time whenever they think about what a pharmacist does. And that certainly is a very valuable position. The community pharmacist is the role that you're thinking of. But beyond the community pharmacist, they do so much more than filling a prescription. And we have a wide variety of pharmacists in the field. So the community pharmacist, also beyond counting pills and filling prescriptions, are an advocate for patients, and they take care of patients. And they are one who has been identified as the most accessible member of a person's healthcare team. And they are often the line of defense against negative drug interactions. So they're usually ones who are compiling scripts from many different doctors if a patient has a lot of different scripts, and they can be that safeguard for that patient's health. So that's one of their major roles. The other thing that they are known for is working with patients to help patients understand how their medicine will work and the interactions that will happen and how to take them properly. So they are that patient's healthcare guard at this point. And one of the other things that they do, which has been very well known, is they give immunizations. So flu season is upon us. You often see many signs for get your flu shot here at the pharmacy. One of the other things that was just recently announced last week by the Department of Health and Human Services is they released guidance that state licensed pharmacists will be able to be immunizing people for the COVID vaccine once one is available. So they will be on the front lines of fighting the pandemic as well too. So that's pretty exciting for our pharmacists. And so, of course, there are other roles that pharmacists do hold, and other patient-focused or primary care patient-focused roles include ambulatory care, who work with patients to ensure the correct medication is given and how that patient is doing over time. So not just the filling the script, but actually following up with those individuals to make sure that they're getting the full benefit of the medication. And then we have other important roles which aren't always visible to patients. All the presenters here work very closely to hospitals in the St. Louis area, and St. Louis is known for their world-class hospitals. In that setting, in the hospital, there are hundreds of pharmacists preparing medications for all the patients in the hospitals and the outpatient clinics. And the roles that they can do can even go on rounds with other physicians in the hospitals to make sure that patients are receiving the medication and helping to make the medication decisions for the patients. So sometimes you might not see the pharmacist if you're in the hospital in that position, but they are certainly there, and they are in the background making sure all the patients are taken care of at that point. Now, we also have specialized role. Can you go back one more, Susan? Thanks. Specialized roles in pharmacy. We talk about cardiology or oncology pharmacist, which is a very specialized area. Unfortunately, cancer is very prevalent, and in cancer treatments, often dosages of chemotherapy drugs are prepared on site only after the patient has a visit with the physician. And so having that pharmacist there in the clinic is very helpful to make sure that patients have the right dosage of chemotherapy after meeting with the physician. And also the pharmacist is available to help minimize the impact of the chemotherapy. Often there's a lot of negative impact coming with those strong drugs to fight cancer. So they are certainly included in the conversations about how to minimize those side effects. And then another specialization, which often people don't really think about, is nuclear pharmacy. And so whenever you start talking about cancer or other such illnesses, they work with specialized drugs that provide radioactive medicines. And so they have a specialization to make sure that they know how to handle the radioactive drugs to make sure that they're used for diagnostic and treatment of such illnesses as well too. All right. So oftentimes people will ask, what is it that makes a good pharmacist? And so that is often a very strong question for us. And one common characteristic that we see for our students is that they have a passion for helping people. And so they have a very strong sense of empathy and wanting good outcomes for their patients. And so also going into becoming a good pharmacist, a lot of our students and professionals have a good memory. They have a great attention to detail. And of course, they have a scientific aptitude and have a strong science background in that. So, and that's one of the things that if you have those characteristics and you are exploring, this might be a good field for you to keep exploring at that point. And so some of our students express that they want to be an important member of the healthcare team. I think it's important to note that a lot of healthcare teams include a pharmacist, and those that do often have better health outcomes for their patients. And for me as a patient, I know I want the best health outcomes for myself and for my family members. So whenever we start talking about who's on my healthcare team, I do include my pharmacist to make sure that whenever I'm on medications, that they're having the right impact and the desired effect on my health. So always think about that as well too from the patient side, because everybody's probably a healthcare patient at some point in their life. All right, so moving on, how do you become a pharmacist? The very big question. So pharmacy has a ton of different paths, and I think that's one of the most exciting pieces about this. It's just putting together a puzzle. So looking at the PharmD program, which is a Doctor of Pharmacy, PharmD for short, it is generally a 4-year program which leads to PharmD. Now, to get into the 4 years, it takes a couple different ways to get there. Students can have a 6-year pathway or a 7-year pathway. I didn't list it here, or you can do an 8-year pathway as well too. The 6-year pathway programs generally require 2 years of prerequisite coursework at the undergraduate level. And then a 7-year integrated bachelor's program has 3 years of undergraduate coursework, and that 4th year is an integrated year. It's the senior year of an undergraduate degree and also the first year of the professional program. And this way you would actually earn a bachelor's degree and a PharmD at the end of 7 years. And also for those students who are maybe pursuing a different undergraduate degree and decide to come into pharmacy a little bit later, after you earn a bachelor's degree, so traditionally 4 years, you could come into the professional program for an additional 4 years. So you can earn your PharmD after 4 years. Every pharmacy program has a little bit difference to it. So this outlines our programs here, but if you're looking for someplace else, you need to talk to your admission counselors to figure out what path is best for you. It seems like everybody has a different path between dual credit, transfer credit, high school preparations. And so that's where we are happy to work with students to balance out and to find the best fit for your future goals as well. All right, so moving on, let's talk about what high school students can take a look at during the high school time to make sure you're well prepared. So we are looking at traditionally science and math. Like I said before, pharmacists have that scientific background. So we are looking for biology and chemistry. That is primarily the foundations of those first 2 years of the 6-year pathway is chemistry, biochemistry, biology, microbiology. Seeing a theme here? Hit the science courses hard in high school if you can. Take as much as you can. And if you have the opportunity to take additional science courses beyond what's required, I would highly encourage that. And of course, keep on that math track. 4 years of college prep math, Algebra 1, Algebra 2, geometry. If you have the availability to do more, please do it. And also, of course, English as well. And so when we talk about the 6-year pathway for a PharmD, these are generally the courses that are required before getting into the professional program. So a lot of science, a lot of math, and then also humanities courses. So psychology, sociology, economics, and these will vary differently by institution. So that's something to keep in mind. And this is, like I said, work with your admission counselors at those institutions that you're looking for to make sure that you're right on track and on target for everything. And so since there are so many different pathways and so many different institutions to go through, some of the things to consider are where do you want to be at the end of 6 years, at the end of 7 years? What type of pharmacist do you want to be? What types of rotations do you want to go on to have your experience in the professional program? So there's a lot of different things to consider whenever you're looking at pharmacy programs. The other major thing is look at your professional network. Who are you going to be practicing with? Where are those alums at? How can you connect with them? One of the places I would really recommend people who are looking at pharmacy is check out the site, Is Pharmacy Right for Me? They have a wide variety of informational pieces and fun surveys, think like BuzzFeed surveys. They're available on there to figure out which role in pharmacy is right for you. And of course, please feel free to contact me at the University of Health Sciences and Pharmacy in St. Louis. And so we would be happy to talk to you about your different paths or just talk to you about pharmacy in general. So you can contact me at jill.geppe@uhsb.edu. So with that, I will turn it over.
Okay, thank you, Jill. So we're going to talk a little bit about, when we think about how do we apply as an undergraduate student to some sort of health career, there's all kinds of different ways to do it. And it can be confusing and they all kind of run together, and some institutions call it the same thing, but it's not actually the same thing. So I want to kind of walk you through different types of health career application processes. So a traditional application would be your senior year of high school, you submit your application to the university, and some universities will also require an application for that academic program. So for example, you're applying to the School of Nursing. Some institutions will ask you to apply to XYZ school for admission to the institution, as well as apply to the School of Nursing for admission. So they're two separate applications. Other institutions will put them all together. So that's a question that you would need to ask. There is a process, it's like it's called pre-nursing. So essentially, or pre-pharmacy or really whatever, but essentially all students that are interested in nursing will start at that institution in a pre-XYZ healthcare curriculum. And then at the end of their sophomore year, they'll apply into the nursing program, into the PT program into the OT program. And I give an example, and these are true numbers from Mizzou. These are not made up, but when we think about like a larger flagship institution, they give you an example of what that kind of process looks like. So for example, at Mizzou, in a traditional application process, you're going to apply for Mizzou as a high school senior. You'll take a curriculum, a pre-nursing curriculum through your freshman and sophomore year. At the end of your sophomore year, your fourth semester, you'll apply to Mizzou's School of Nursing. At that point, they're looking at your college GPA, not your high school information. And so typically Mizzou is looking for about a 3.65 in their high school or undergraduate GPA. They have almost up to 200 applicants sometimes, and they have about 75 spots. So that's not a guaranteed seat. That's not a guaranteed program. So you could go through this program for 2 years, but then potentially not continue in the program. So some students will say, gosh, I don't know if I want to take that chance. What do I do? Usually, if you're not accepted to the program, then you'll have to choose a different major, or maybe you could reapply the following semester, or you could choose to transfer. And transferring is absolutely possible. Some institutions have transfer opportunities, some do not. So you'll just want to investigate all those pathways as you're thinking about how you're applying. Direct admit is one that you may hear about more. And
I don't want to interrupt, but your slides are not showing. You want to click through your slides so they can see what you're talking about?
You know, Shawnee, they're showing on my screen here. Thank you, Shawnee. Thank you.
There you go.
Apologize, everyone. So when we think about direct admit, this would be applying directly into a program. So you're going to apply as a senior in high school. You'll submit your application. You may have to submit that secondary application, but it's a direct admit. So you'll hear this a lot: nursing, PT, occupational therapy, athletic training. Essentially, you're going to have a guaranteed seat in the program, and it's your seat to lose, meaning there's an academic criteria you have to maintain. It would be your seat to lose. So this is popular, although many of them have rigorous curriculum, have a rigorous academic profile that they're looking for. So you're looking at starting it right away with that safe seat. So that's a benefit of a direct entry program. We think about accelerated programs. So these are programs, when we think about pre-admit programs. So these are early admission programs. So essentially, universities save seats in their graduate programs for students at the undergraduate level. So think of these, at SLU, we call these scholars programs. So for example, like a medical scholars program where a student would apply to have a guaranteed interview to our SLU med school at the end of their sophomore year. Our speech pathology program guarantees them a seat in the graduate program. Our pharmacy scholars program guarantees them a space at University Health and Sciences Pharmacy, formerly St. Louis College of Pharmacy. Our physician assistants program saves them a seat in our PA. So it's kind of a comfort piece, like, okay, if I continue well in undergraduate, then I'm going to have this guaranteed seat or interview into that graduate or professional program once I finish that. Some institutions allow those opportunities for current students. Other institutions are looking for those opportunities only for first-time freshmen. So you'll want to ask what that process would look like for you. And then we think about accelerated programs. And these are programs that we hear about a lot. Students will say, do you have a 6-year PT program? Do you have a 5-year AT program? So they're accelerated. Typically, a physical therapy program would be 4 years of undergraduate study and 3 years of doctoral study. So the physical therapist is required to have a doctorate to practice. So when we think about accelerating, many institutions have programs that are 6-year direct entry accelerated doctoral programs. So at SLU, for our physical therapy program, we do have a 6-year DPT program. You apply as a first-time freshman. Your first 3 years will be undergraduate work. Your 4th year, your senior year, will be graduate work, although we will count it with your undergraduate work where you'll earn a bachelor's degree. And then you'll finish the final 2 years in graduate level work where you'll receive your doctorate. So you would graduate with a bachelor's, usually it's in exercise science or health sciences, and then a doctorate in physical therapy. And that would be a 6-year program. Typically, those programs are going to require some study, summer study work, lots of shadowing and observation opportunities. Occupational therapy, traditionally 4-year undergraduate, 2-year master's program. The industry has announced that they will be requiring a doctorate as well to practice for occupational therapy. That still has a 9-year, like 9 years before it's implemented in the industry. So institutions have time to move themselves towards that doctoral process. Currently, we are still managing the master's program, and then the following year we'll move into our doctoral process. But typically you're looking at 4-year undergrad, 2-year master's program. You would accelerate that into 5 years. Athletic training, very similar, 4-year undergrad, 2-year master's program. Sometimes you'll see a medical, if we have anyone interested in medicine, sometimes you'll see accelerated med programs. So UMKC is a very popular one here locally. They have the 6-year accelerated medicine program. So essentially they're taking 8 years of undergraduate and 4 years of undergraduate, 4 years of graduate work, and they accelerate that into 6 years. And then some of those also have guaranteed admission opportunities. And then nursing also has an accelerated option, and it's called a baccalaureate degree. So essentially it's for students that have already graduated from college and have a bachelor's degree. And then afterwards they've decided, you know what, I think I really want to go back to be nurse, or I wasn't able to get into the nursing program at the undergraduate level, so I got my bachelor's degree in health sciences. And now I'm going to do a 1-year accelerated baccalaureate program where they can receive their BSN. So there's a variety of ways to fall into that accelerated program. The main theme amongst everything that all 3 of us, and really every college is going to talk about, is that every college is different. Although we have very similar programs, there's still differences to those programs. So you'll want to really get to know your admission counselor at whatever institutions you're looking at. They're going to be the best resource for you. They can help you stay on track for your senior year. So for example, our physical therapy program is a first-time freshman entry only. We do not accept transfer students, and we do not accept graduate applications because we're full from the beginning. We have science requirements, you know, full year of biology, a full year of chemistry. Our nursing program does not accept transfer students either. It's first-time freshmen. So when we're thinking about what we're looking for in your application, you can ask your admission counselor, are there things that could enhance my application? Does SLU require a nursing essay in addition to my admission essay? Every institution is different. Things that are really going to help highlight your application will be any volunteer or service opportunities. And sometimes students will say, well, I didn't really have the opportunity to do healthcare service. And we know the time that we're in right now, that is more challenging. But really, these programs are looking for service to others. How are you serving or have an interest in serving others? That's really where they're at. And the biggest piece of advice is figure out who's the most organized person in your family. Put the spreadsheet together, put the folders together, keep everything organized, but whoever's the most organized can keep track of all this. Some institutions will require, and healthcare is the most common for this, an institution is test optional, meaning that for admission, they don't require a test score. However, there is a test score requirement for a healthcare field. So you want to keep it all together and all straight. And I'm happy to answer any additional SLU questions that you may have here at the end. I'm going to turn it over to Shawnee and let her go.
Thank you, Susan.
Yes.
So we were often talking about pathways to health profession careers. So I'm just going to continue that conversation in respects to Maryville. Moving on to the next slide, you can see we all assume if you're in this session, you're interested in healthcare. So some quick statistics about healthcare occupations. It is one of the fastest growing fields. So it's projected to grow 15%. And this was done before COVID. So I can't imagine what that looks like in post-COVID world, especially those essential workers, healthcare frontline workers. I'm sure there's going to be even a higher demand for that as we move through this. But it's growing much faster than the average for all occupations. So if you're interested in healthcare and you're not sure exactly what field, just know that your interest itself will pay off in the end. There are definitely jobs that are going to be available as well. So why healthcare? Well, there's a few things that if you're thinking about healthcare, one is job security. I just talked about the growth, right? So I know if there's parents out there that are in the session, that's usually some of the questions we get is like, what is the career outlook? What is the job outlook? When you're talking about healthcare, that's a confident conversation we can have with you about the job outlook and that job security. Your location options are varied, right? So you're not, some professions you're sort of confined to a certain part of the country, depending on what's happening. But with healthcare, you can really pretty much work all over the country, all over the world in healthcare fields. The other cool thing about healthcare is that it requires varying levels of education. Susan touched on it a little bit. Jill did too. I mean, you can range everything from being an RN that doesn't necessarily require a bachelor's degree, all the way up to being requiring a bachelor's degree, or jobs that require a doctorate. So your pharmacy, your physical therapist, that sort of thing. So again, it gives you flexibility, and it also gives you career advancement, right? So if there's varied education levels, you can start out with that bachelor's degree, especially in nursing, and then continue to move into your master's and a DNP. And so again, there's a lot of room for advancement in the healthcare field as well. Really competitive salaries when you're talking about healthcare. So, and that's across the board, whether it's pharmacy or physical therapy or medicine, the salaries are really competitive. So again, not only do you have job security, but you also have the comfort of knowing, we all know this is an investment when we start talking about the cost of education, but healthcare is one of those fields where you'll definitely see return on your investment. And then it really is just rewarding career. I know that Jill talked about some characteristics and attributes of the types of students and people that go into these fields. And those are folks who want to help other people, right? So that is rewarding. So these careers tend to be really, really rewarding. So things to consider when considering healthcare. Jill touched on a few of these, and I think these are going to be consistent across the board, no matter what major you're in healthcare. Great communication skills are going to be required. You are working with patients, you are working with people. So you want to make sure your communication skills are strong. That's one of the components probably of all of our programs, is not just the field and knowledge of the field, but also helping you develop and strengthen your communication skills throughout your academic career. You want to be passionate about this, right? So oftentimes what we see is we have a lot of students who think they want nursing until they see blood for the first time. And then it's like game over, not interested. So one of the things you can do, and Susan touched on this a little bit, I think Jill too, shadow if you can. It's a little harder now to do it in COVID world. But if you get an opportunity, or just YouTube video, I guess you could do that now without shadowing. Check it out, because we do end up having not a lot, but some students are like, yeah, I'd love to help people, but I just don't do bodily fluids and blood and all that good stuff. So, and that's okay. If you don't want to do that, there are still a lot of fields in healthcare that you can actually, pathways you can go down without actually doing, without actually seeing blood. You got to be flexible. Imagine all the healthcare workers and how they had to be flexible when COVID hit, right? So that's a flexibility, something that's built in. It's got to be built into your personality. Got to be a team player. As you imagine, whether you're working in the hospital or you're working at pharmacies, it is all about sort of a team effort. You know, if you've ever been in a surgery, I'm hoping nobody has. I know I have. It's always a team of people that are working to get you better. So team player. That attention to detail is very important. You got to have empathy, right? I mean, we're working with people in their health, so you definitely have to have empathy. And the thing that is really important now, more so than it ever has been, is your technological skills. It's interesting. I have a cousin who's a doctor, and she said the nurses that are retiring now, usually when nurses retire early, is because the hospitals brought on a new system to work. And, those who are close to retirement are like, I'm not getting ready to learn a whole new system again on how to process everything. So medicine is about technology as well today. So healthcare is about technology as well today. It's more technology than you think it is. So being technically savvy, you'll get that from all of our institutions with the state-of-the-art labs and the facilities and the equipment and all that. You'll get that, that feeling and that experience at all of our institutions. So these are just some things you want to consider. So some pathways at Maryville. SLU and Maryville are very similar in some of our programs. And so I don't want to go into detail on there. But we also offer early direct admit and guaranteed programs. The nursing is a freshman direct admit program. And I talked about the varying levels of degrees. So you have your nursing, which is a direct entry program that leads to a bachelor's degree. And then similar to SLU, the only difference is sometimes the number of years in the program that you're spending, but we both offer direct entry programs into our graduate level physical therapy and occupational therapy and speech programs. So again, something you want to consider. One of the things that we do talk to students and parents about for the direct entry programs is it is a commitment. I mean, if you're committing to 6.5 or 7 years or whatever it is a commitment. Now, I say that saying you can change your mind. You can get into the program, change your mind. We all do. I started out as a pre-med major in college, and I ended up with a criminal justice degree, and I work in admissions. So you can change your mind. It's okay, and still be successful. But before you enter into that program, you want to seriously consider, is this something I want to do? Because it is a true commitment, whether it's the pharmacy, whether it's 6 years here, 5 years there, it is really, truly a commitment. If you're teetering on that commitment, there are other pathways, and Susan touched on these too, some pre-health professions programs. So we have students who say, I think I want to do physical therapy. I just don't know if I want to commit to a 6 or a 6.5 year program right now. Great, you can do pre-physical therapy. And again, just a different pathway to get there, where you would do your 4 years of undergraduate, and then you would apply to a graduate program in physical therapy. Same thing with occupational therapy, and same thing with speech language pathology. And then I kind of put in a small little font because pre-health professions, period. If you want to go to medical school or any sort of graduate level program in the sciences, in the medicine area, these pre-programs are pretty much programs that most schools offer. And it's just a track that they get you on to prepare you for graduate school. But because they're pre-programs, it gives you a little bit more flexibility when you change your mind and decide it's not what you want to do, then you have some more flexibility to sort of move around in your curriculum. So a lot of different pathways to get you there. But healthcare is a wide field. And Susan and myself and Jill only talked about some of our specialty programs and some of the programs we're known for. But go ahead and check us all out or Google it, because there's a whole lot of other fields in healthcare that may interest you as well. So if you do have questions, I'd be happy to answer those questions for you as well. We did resume on-campus visits at Maryville, so you can schedule an on-campus visit, and then we have a variety of virtual events that we have coming up. So just check out our webpage if you're interested in any more information about Maryville. Thank you, Susan. You did a great job with the slides.
Thank you, guys. It's a new world. I'm starting my 16th year in college admissions, and this is a whole new world,
I won't say what my years are. I'll just keep that to myself.
I'm right there with you.
I saw a few questions in the chat. Let's see.
Say one of the questions we had was about forensic pathology fields, and if a career could be launched from any of these majors or any of these courses.
Do you want me to go? I can answer.
Sure, absolutely.
Yeah, absolutely. So we have a variety. That's a variety. There's a lot of options for that. A lot of that's going to be graduate level work. So like Shawnee was talking about, you can start in any really area. You can start in there is forensics undergraduate programs. You could even start in criminal justice. You could start in English and take science coursework. So there's a variety of ways to start that. And then you're really going to specialize as you get more into graduate work. I will also remind students, I always remind them that forensics has a large chemistry component to it. So you really want to make sure that you enjoy chemistry, that's something you're aware of as part of your studies. With forensics. Do you want to add anything, Shawnee?
Just that you're right. It's you can actually go into a forensic science degree program, but the one thing that students do forget about, because they're so used to watching crime shows on TV, is that chemistry is a strong foundation. So if you are not a chemistry person, you might want to think about a different pathway. But if you really want to be in the lab as a forensic scientist, then you're looking at almost a chemistry degree for the most part, if you're looking to do that. And then, like Susan said, you can get into some more specialty areas in the graduate level programs.
Yeah.
All right, we have another question coming up here. If you could explain the difference between pre-occupational therapy and occupational therapy assistant.
Yeah, so I can go first, and then Susan, because we both have it. So an occupational therapy assistant doesn't require a bachelor's degree. So you actually don't have to go for 4 years to get a bachelor's degree to be an occupational therapy assistant. Pre-occupational therapy is a pathway to a graduate program as an occupational therapist. So if you're looking to, so it depends on your career goals. If you're just looking to be an occupational therapy assistant, you can Google those programs, and those are typically 2-year programs that you can go into, finish, and become an occupational therapy assistant. If you want to be an occupational therapist, you're going to have to either do the pre-OT route, where you do 4 years as an undergrad, and then you apply for a graduate program in OT, or the direct entry path that Maryville and SLU has that leads you directly into the graduate program so you can become an occupational therapist.
See, all right, we've got another question coming in. What is a good school for pediatric surgeons?
Yeah, so let me answer that. Students ask all the time, what's the best medical school? And I mean, you could certainly use US News and World Report and see your rankings for medical schools. But really, it's about your undergraduate experience. So pediatric surgeon is a post 4-year. So you'll do, let me explain the medical track in case you're not clear. So it's 4 years of undergraduate, 4 years of medical school, 3 years of residency, an additional year of specialty, and then if you're going to be a surgeon, it's an additional 2 years of residency. So we're talking about an 11 to 12-year path to be a pediatric surgeon, okay? And typically, when we're thinking pediatric surgeon, then students start to specialize in cardiac surgery or neonatal neurosurgery. So that's a very long path. So speaking just undergraduate and graduate, it's about your experience at the undergraduate level. So you have to take math and science, and you have to do well in them. You have to get A's, really A's, maybe B's, A's and B's. You have to shadow. You have to be able to articulate and communicate well. You have to be able to write well. And research is highly encouraged. Although it's typically not required for med school admission, we usually find about 80% of med schools are admitting students with research experience. So that tells us that they are looking for research. And I'll give you some number statistics. SLU Med School is fantastic. It is not in the top 10. If you look at the top 10 medical schools in the country, SLU falls below the top 10. We typically have about 10,000 applications to our medical school for about 200 seats. So we are accepting around 2% of our applicants. That's very typical of a medical school. So it's very competitive. So everything you're doing at the undergraduate level, it needs to enhance your application.
Okay, and we are just about ready to wrap things up here, but we do have a few more questions. So we've got 2 more questions. The first one is, if you get your occupational therapy assistant degree, can you later use that to go to a school to be a full therapist?
Yeah, so if you got your OTA degree, you got credits, and you decide later you want to come back, yeah, so you can apply as a transfer student to come in into a pre-OT program. And then you can actually, once you finish as your undergraduate, you do well, you apply for the graduate program as an occupational therapist. So yeah, that's definitely a pathway. It's similar to nursing. Some students will start out with an RN and become a registered nurse, and then they decide they want to BSN, and they just come in and same thing, they transfer into a nursing program and then finish their bachelor's degree.
Yeah.
All right, very cool. I think this is a very appropriate question to wrap up our session with. As a student who does not know the path in healthcare they want to take, how would you suggest they figure it out?
Jill, you go.
All right, awesome. This is where I think students should really talk to professionals, talk to their university admissions representatives, and connect with professionals in the field, current students, talk to people who are in the industry. You can Google just about anything nowadays. That's always a good place to start. But talk with the people who are going through the coursework and who are out practicing. And I know we're happy to connect students with alumni. I'm sure everybody else on this call will be happy to do the same as well.
Okay. Any other questions?
Okay, I think that's it.
Yeah.
Perfect timing, Michelle.
Yes, awesome. Wow. You guys are fantastic. I'm over here taking notes furiously, and I'm going to come back and share this with my students. Excellent. As a school counselor who gets a lot of these questions, you guys did a phenomenal job explaining the intricacies of all of these programs. You just did it beautifully. So fantastic. And for that last question about the career exploration, if I can make a little plug, we have a couple sessions on October 4th and 5th that are career exploration specific. And I believe the one on October 4th is the one that will specifically talk about ways to gain experience as a high school student. One of the ways through healthcare and other industries. So students, you might want to sign up for that October 4th. I believe it's at 4 o'clock, career exploration. You'll see me again. That's how I know about it. So again, thank you ladies for sharing such great information with us today. I am now going to share my screen with just a few wrap-up students. So if you'll hang on just another 30 seconds, and I want to share this screen with you students as we wrap up. Okay, students, so hopefully you can see this screen. Again, thank you so much for joining us with the first of many of our Show Me career sessions these next 4 weeks. Once we end the session, you will have a very quick 4-question survey. We do appreciate your feedback as we continue to program and meet the needs that you have across the state. Again, we'd love for you to sign up for more sessions. If you'd like to connect with one of these schools specifically, I'm sure they all have sessions coming up in the next few weeks and would love to see you and to tell you more about their particular institution. And lastly, we do have our recording available. I, again, will be checking that out in a couple days and using it with my own students. And you will find that on our website at which is MOACAC.org. So again, thank you to our panelists. Thank you, students, families, and counselors out there, and have a wonderful evening.